Hello, this is Dr. Kavyan Malani for Virginia Medical Updates. Today I want to talk about obesity. Obviously everyone knows that obesity is a major American or maybe kind of the Northern American issue in terms of the cause of diabetes, hypertension, cardiovascular disease, heart attacks, and general depression, fatigue, insomnia, sleep apnea, and a lot of other problems. The goal for this short presentation today is to talk about depression in the setting of obesity. Obesity basically is a major medical problem, and it is basically a balance of calories issue. So people normally consume calories, and people also burn calories. The resultant excess in calories that are intaken by the body compared to minus what is taken out through exercise or natural burning through the metabolic rate causes a caloric surplus and excess in calories, and this over months and years begins to build up, and it causes the phenomenon of obesity. Clearly, obesity is going to be difficult to control for the next few years. And the reason is that when we look at the children, the adolescents that are growing up now, the number of children that are obese is definitely on the rise. And a number of studies now have suggested and have actually documented that the medical interventions to help obesity in children is not very effective. So clearly this is going to be on the rise in the decades to come. For the adult population, this excess in calories needs to be balanced out in two particular ways. One way is going to be the use of healthier foods that are not processed, that are not coming out of the box, that are not microwavable things that we just buy, that are processed in a factory and is part of the food industry's packaging. Stuff that grows out of the earth that people can grow themselves or to buy and are basically natural are really much better food sources. And I believe that one issue is that everyone needs to take time out of the busy Fairfax, the busy Virginia, the busy Washington, D.C. lifestyle and increase physical activity. Something as simple as half an hour of fast walking 3 times a week, 4 times a week can be really beneficial. I also really want to emphasize that potentially the use of technology, like use of iPhones and smart devices like Garmin watches, for example, or Fitbit, and etc., are really beneficial potentially for keeping track of calories, even though there are some studies that show that there is potentially no benefit. But I believe that most of these studies have not been organized in a good way. Clearly, if people can keep track of what they're consuming and what they are actually burning, they could be much better in terms of their caloric consumption of food. So I do want to emphasize healthier eating, increased exercise, better sleep, stress management, and when it's all said and done, basically a better lifestyle. Thank you. This is Dr. Kavyan Malani for Virginia Medical Updates.
Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today we're going to be discussing vitamin D and sun exposure with Dr. Liana Abramova. Thank you for being here with us.
Thank you for having me.
And today's topic is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement the expertise in medical care. The areas of focus are in weight management, preventative medicine, and holistic health. And just a little background on Dr. Liana Abramova. She has a medical and cosmetic practice in Fairfax, Virginia. She has been in practice for over 15 years and is originally from the former Soviet Union. She attended UVA for her undergraduate studies and Emory University in Atlanta for her medical school. After she finished her residency at Washington University in St. Louis, she returned to Virginia to be with her family. She has authored several articles on melanoma research and is an active member of DC's Dermatologist Society. Dr. Abramova has special interest in prevention of skin cancers and general dermatology. So thank you again for being here with us. Your special interests, of course, are going to be perfect for our topic today, which is vitamin D and sun exposure. So tell us a little bit about how much the sun exposure, how much sun exposure do we actually need in order to have our right amount of levels of vitamin D?
You know, vitamin D is such a hot topic in dermatology, and I'm sure it's in entire medicine. We always talk about it, and we never know whether the adequate levels of vitamin D in our body are overall. And we never know how to get enough vitamin D in our systems. There's two ways that our body can get vitamin D. One of them is through nutritional supplementation. We either can take a vitamin D supplement, like a vitamin, over the counter, or we can synthesize it in our skin. In order for our skin to produce vitamin D, we actually have to be exposed to a little bit of light, and that has to be a UVB type of light, which is usually found in the summertime, and it's very difficult to get enough of UVB in the wintertime. So in our daily routines, we usually don't get a whole lot of UVB exposure in the middle of the winter, if you think about it, especially in Virginia winter. So the best way to supplement vitamin D levels in the wintertime has to be through taking vitamin D vitamin. However,
so the actual tablet we need
the
to
actual
make sure
tablet.
That we're taking.
And there's different types of tablets that are available. Usually D3, it's the most widely available vitamin over the counter. There's different levels of vitamin D which you can get. There's 200 units, 400 units, 800 units. All of this has to be measured before you decide to take a supplement. You have to get your levels before you decide to supplement yourself.
And is this just a blood test that can be done?
Yes, you can go to your primary care physician and get your vitamin levels measured. They usually measure the inactive form of vitamin D, the 25 version of it. Before the vitamin D gets converted to its active state, it has to get metabolized by your liver and your kidneys before it finally gets to be the final version of it.
Okay.
What usually happens when it gets activated, it goes into your skeletal system to help synthesis of the bones. It also acts on our immune system to help protect us sometimes from respiratory infections and other types of infections.
Okay.
It also is very active in our GI tract, and some vitamin D receptors are found in prostate tissues and breast tissues. Vitamin D has been found in mostly every cell in our body. So it's very important to get that measured, and then once the levels have been obtained, we can decide whether or not you need supplementation or not.
Okay, so obviously a really important vitamin for our bodies. Now, if it is something that's low, is there a specific amount of either supplementation with your medication or from the sun that you need, depending on the season, summer or winter? Is it always going to be the same?
You know, there have been different studies done when they measured healthy volunteers levels on their skin of their vitamin D levels in their body during wintertime and during summertime, and they found that during wintertime it actually does go down. They also measured vitamin D levels during summertime in healthy volunteers when they applied sunscreen on them, and then the patients who did not have any sunscreen on them, and they found out that patients that use adequate amounts of sunscreen on their body have lower levels of vitamin D in their system. Okay. So it's sort of, you do need to supplement. Now the question is how to supplement, and there's a whole lot of talk in the media and in all the journals that you read, but you need to get it through the sun. However, there's lots of studies at this point that came out and said specifically that supplementation with the sun when the skin is exposed to UVB light results in multiple skin cancers like basal cell and squamous cell.
So it's a dilemma there. It's can you get enough from the sun,
or do you supplement?
Exactly.
And I think that American Academy of Dermatology strongly recommends recommends for all of our patients to get their supplements by nutritional support.
Okay.
There's some foods that are really rich in vitamin D,
Okay.
and that would be something like salmon and tuna. Some of the milk products are supplemented with vitamin D. So is orange juice nowadays is supplemented with vitamin D. So that's a good way to get it into your system.
Okay.
There's also a variety of vitamins that are available. If you go to any grocery store, you can get D3 vitamins, which you can get, and you can go to your primary care doctor and they can write you a prescription if you're really, really low.
Okay.
Now the question is, what is the normal levels? There's 3 levels that we'll always talk about with vitamin D. There is deficiency of vitamin D, which is usually less than 10 to 20.
Okay.
Insufficiency, which is sort of like a gray area in medicine because we don't really know what that insufficiency is. And then there's levels that are normal,
Okay.
like high levels. And
What is the goal level that somebody
I think
should have?
anything above 20 to 30 is probably the best levels to be in. You can go
Okay.
always higher. There is no proven study that shows that high levels of vitamin D result in significant toxicity.
Okay.
There have been some studies that show that maybe increases risk of kidney stones because sometimes vitamin D is ingested together with calcium. So if you
Okay.
overdo it, then you can increase your renal stones.
But would you say you might benefit more if your level is higher versus, obviously a lower level?
It's such a controversial topic, but I always say it's best to have it measured before you start supplementing yourself,
Okay.
and then decide what kind of, what is the dosage that you need to be taken correctly, not to overdo it. With vitamin D, I usually say 200 to 400 units. Those are standard units, would be sufficient for a normal adult, but for our elderly patients and for young kids, they probably need to be slightly higher.
Okay, so that would be a daily intake that you would recommend.
Daily intake.
Okay.
For some of our patients, we prescribe, like the ones that are not very good at taking pills, you can take higher doses of vitamin D. And some of it just doesn't get absorbed so much because not every pill that you take get absorbed through your GI tract. So it has to be, you can take it every day. I think the absorption is better. And I also think natural ways to supplement. In the past, they used to take cut liver oil.
Okay.
This was sort of like maybe not so.
I'm sure everyone's favorite
I'm sure
supplement.
all the kids love taking it.
Yes.
But it was a very good way to treat children that were, having rickets, because that was the best and fastest way to respond to it.
That was caused by low vitamin D
By low
levels.
vitamin D. But I think in the United States overall, such low vitamin D levels are not observed anymore.
Okay. So if that's something for the vitamin D, as far as what we can take, the supplements, obviously checking those levels. Talk to us a little bit more about the sun exposure.
Let's talk about that. Let's talk about sunscreens.
Okay.
How do we decided that, we can supplement our vitamin D levels so we don't have to be exposed to the sun to get the correct levels into our body.
Right.
Now, there's so many different sunscreen to protect ourselves when summer comes, and it's so hard to decide what kind of sunscreen to use.
Right, there's a whole aisle with
I know.
sunscreens.
I just, I go there and I get lost. So I try to find something that has zinc or titanium oxide,
Okay.
because a really more effective way of protecting yourself compared to the chemical types of sunscreens. There's usually sunscreens are divided into chemical and physical sun blockers. Zinc and titanium is a physical sun blocker, and everything else is a chemical sunblock.
Okay.
The controversy with regards to sunscreen exists because some studies have been reported that showed that they cause increase in your hormonal levels. And those studies are really controversial because they pretty much fed sunscreen to the rats at super high levels, and they
wow.
all developed some kind of hormonal problems. Majority of us don't ingest any of
Right.
those sunscreens,
Right.
and so those
I hope
studies
not.
can never be applied to normal human beings. And so, the media took it out sometimes of the context, and they go with it and say it's bad to apply sunscreens. But I think that zinc and titanium oxide are pretty safe. They're
Okay.
natural ways to protect yourself.
So should those be one of the first ingredients?
Yes. So when you buy a sunscreen, you look on the back of that bottle and you look for the active ingredient.
Okay.
And there's no specific level. 30, 40, 50 SPF factor, that's a great number to start.
Okay.
There's also hats that I love. I make my kids wear hats all the time.
Okay, extra protection.
Extra protection for their scalp, because you can't really spray the scalp or apply sunscreen on the scalp, especially for our guy patients that are a little older. They don't have much protection there.
Right.
I also like long sleeves. I know they're hot, but they're light fabrics that a lot of companies now make.
Yeah, we see a lot of those kids wearing the shirts, kind of like the surfer shirts, maybe.
They're rash guards. They're fabulous, and they're easy to put on, and there's not a lot of chemicals. And I think we should utilize them a little bit more frequently.
Okay.
They're also available in adult sizes, and I don't see a lot of adults when I go to the pool wearing those, but we should start thinking about those.
Okay.
And hats, sunscreen, sun shirts, I think those are great ways to protect your skin and avoid exposing ourselves to UVA or UVB rays. And there's no need to supplement our skin with natural sunlight other than just taking a little supplement if we need the vitamin D to go in.
Okay, so now if it is something that maybe somebody is just only applying sunscreen, would you recommend, I know some may have heard that you should maybe wait to apply your sunscreen so you get some of that vitamin D from the sun and then apply?
Once again, even if you apply sunscreen, you're probably going to get a little bit of that vitamin D going, because not enough of us apply enough of that sunscreen. It has to be 2 microgram per centimeter square to cover your body correctly. Nobody uses that, I can tell you that. It's not because of my personal experience, but because of many studies have shown that no normal application of sunscreen does not result in decreased absorption of vitamin D. So we can safely apply our sunscreen, get enough of that vitamin D into our system, and put our hats and long sleeves and avoid any kind of UVA and UVB rays that cause skin cancers, because those skin cancers can be really destructive, especially melanomas. They're on the rise in our young females due to tanning beds.
Right.
And the tanning bed industry always advocates using them because they try to imply that using tanning beds increases your vitamin D levels. And once again, that's not true, because you can supplement it easily with over-the-counter products.
Okay, so if that's a thought that someone is thinking by going to the tanning beds, they should just obviously try to use foods instead.
Yes, tanning beds is such a hazard to our health. It's been shown that tanning beds is equivalent probably to smoking. We try to avoid them as, yes, and smoking causes so much cancers, and so does tanning beds. I see a lot
of the tanning bed salons are still really prevalent.
I know, it's amazing when some people continue to use them. I see 18-year-olds and 19-year-olds and all those young females continuing to attend them, thinking that it gives them both some vitamin levels, but it's probably not true. And number two, they always say it makes me look better, but we have to try to achieve better looks either by spraying a little bit of a
spray tans.
Those are okay. I think that there haven't been any evidence to show that they are somewhat harmful to our health.
Okay, and obviously they're a risk because, as you mentioned, it can cause skin cancer.
Yes.
Talk to us a little bit more about that. What are the risks with it?
Tanning beds increase the risk for melanoma by probably 4-fold. And it's not just, I went only once or 5 times. That 5 times can show up a little bit later on in life. 10 to 15 years after exposure to tanning bed, the risk of melanoma quadruples for our patients. And it doesn't have to be 10 to 15 years. I see plenty of 20-year-olds with tanning beds exposure that have melanomas. And it always used to surprise me, but now I'm a little bit more aggressive on screening those patients and making sure that we see them at least once a year after they've been exposed to tanning beds 4 or 5 times in their lifetime, because their risk of skin cancer, not just melanoma, but also less dangerous types like basal cell and squamous cell carcinomas goes up.
Okay, that's so interesting. So yeah, as you mentioned, it's such, you can relate it to smoking. I mean, it really is a cancer-causing.
Right, and tiny little melanomas, majority of times they can easily be treated if detected early. We bring a patient in, we analyze their skin, we try to find all the typical moles, and hopefully they look at themselves as well, and we remove them in a timely fashion, and that prevents any types of, hopefully down the road, metastatic disorders. But once again, we want to protect our skin from those harmful UVA and UVB rays that are sometimes advocated by the tanning industry.
Right, okay, so such an important topic for us today, and we really appreciate you being here again with us.
Thank you for having me.
Of course, and thank you for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and we hope to see you again next time.
Hello, this is Dr. Kaveh Melani for Virginia Medical Updates. Today I'd like to talk about two issues that have come up in medical literature in the past few months that I think is very beneficial for everyone to know. The first one is that after a number of important studies that have been done over the past couple of years, there has been always a particular concern about dementia and about whether in the population that are becoming losing memory or people that are moving towards Alzheimer's, if there is any potential benefit in treatment that can prevent that. But there are a number of studies that show that a number of medications have been effective and are working to some extent. They basically bend the rate of the rise or the progress of Alzheimer's and other forms of dementia, and they're pretty beneficial and useful. But one recent study that came out was very important. There has been this idea in the medical community that basically for whatever reason, that the use of statins, the cholesterol reducing medications, due to some unusual effect, maybe anti-inflammatory effect, maybe anti-plaque effect, or other factors, it could actually cause a decrease in the Alzheimer's rates. Well, it turns out that this is a complete false assumption, that the use of statins in this population did not really lead to any improvement in terms of prevention of Alzheimer's disease or any form of dementia. So as always, increased activity, basically dietary lifestyle issues, sleep adjustment, treatment of depression, and again, management of cholesterol on a normal level is very helpful. Exercise, physical activity, grip strength. But what has not been beneficial is the use of statins on a random basis for all populations, and regardless of statin and regardless of state of the patient, to cause a decline in dementia or Alzheimer's incidence in the patients. So again, as a whole, we do not at this point, based on evidence and good studies, cannot recommend the use of statins to prevent Alzheimer's disease, and this is basically all there is to it. The other issue that's very interesting is the prevention of falls in the elderly. The elderly obviously have a high risk of falls. Falls in the 65 plus population is extremely worrisome and dangerous. People that fall down, there's loss of productivity, and about people that fall down with a hip fracture, 25% may actually be dead in 1 year's time, and there is a huge mortality, obviously, and a huge morbidity with these falls. The most important issue is that if there is a vitamin D deficiency, the treatment of vitamin D deficiency is beneficial. But random vitamin D supplementation does not cause a prevention in falls. Again, I want to repeat this again. The random supplementation of all comers with vitamin D does not lead to a decline in falls in patients that are 65 years of age or older. However, in that population that has a low vitamin D, the supplementation of vitamin D actually does help. Mega dose of vitamin D pills of 100,000 units or more, or 1 million units, have not been shown beneficial and potentially actually can be harmful. Then the normal kind of random advice about fall prevention and about careful household adjustments are not really beneficial, even though it's done frequently. What is really beneficial is an analysis of the house, of the home, by an expert person that could look for risks of fall. Where are the cables? Is there carpeting? Are there stairs? How is the lighting issue to help prevent any type of fall? Again, these falls at a minimum on average cause about a number of months out of work, basically, and they have a significant amount of mortality and morbidity and loss of function, and there could be really bad things for the patient. So every fall, on average, costs the patient also about $17,000 every hospital admission for a fall. So these falls are not benign events, and so they need to be prevented, but the best thing to do is to bring the vitamin D level up when it's needed. Do a careful analysis of the house in terms of lighting, wiring, carpeting, stairs, to make sure that the bathrooms are accessible to the patient, that the patient has some help when getting in and out of the bathroom, and when they have to go to the kitchen, etc. And basically, we need to make sure that the elderly or 65 and above are actually safe during this. One simple test is a get up and go test, which is a very useful test to predict falls, which basically you have a patient kind of set up from a seated position and go a number of steps and come back down and sit down in a matter of 3 seconds. And if that can happen, then that really means that the patient is safe for this particular fall. But most, oftentimes elderly are not able to do this, and that means that they're increased risk of falls, and these falls have to be taken very seriously. Again, also strength training, getting them stronger, grip strength, walking, and in the cases where we have to, supplement their vitamin D is exceedingly beneficial. This is Dr. Kavian Milani for Virginia Medical Updates. Thank you.